Good morning, Paris. Hope everybody is fine and refreshed. I want you to remember something. 2010, in the state of Florida, they received a call by an Alexandria Tobias. She contacted 911. She stated that her 3-month-old boy has suffered head injury. The boy was taken to the hospital. The boy died. It turns out that Alexandra Tobias was on a game at that time known as Farmville. That was around 2010, where everybody wanted to be a farmer online. Does anybody remember that game? And she was playing that game, and the boy was crying. She picked the boy up, she shook the boy up, the boy fell out of her hands, hit the table, had brain injury, and died. She was given 50 years as a manslaughter in the state of Florida. And that was because of a game called Farmville. Does anybody remember Pokemon, the game? Yes? I think there have been a lot of deaths, and in a certain state of Indiana, I think there has been 15,000 more police-related and traffic-related incidents. Does anybody know of a game which is a kind of a craze known as the Fortnite? Do you have teenage kids? If you have, just go and check whether they are on Fortnite, because it's a global phenomenon. More recently, in United Kingdom, an 8-year-old girl was admitted to a pediatric unit, a mental health unit, because she refused to go to poo and wee, and used to do it in the bed, and became so hooked on that that they had to bring in a psychiatrist and mental health team to take her to the hospital. Does anybody remember, if you're in UK, probably you'll remember it, around 2008 and 7, in the county of, I think it was around Cardiff. There's a place called Bridgend, and they had 15 to 20 teenagers basically committing suicide by hanging themselves. Does anyone remember that? Somebody said it's a cult, somebody said it has got different name. It had different perspectives to it. And one of the reasons that it became an endemic at that time was a social media platform called Babel, in which the cyber teenage suicides were glorified. And that actually encouraged others to commit the same crime, to commit the same. So, it's ironical, I found out this conference through a social media platform, LinkedIn, and I'm going to be speaking against it. I know everybody would know that it has its perks, it has its privileges, it has its connectivity, but my topic today is social media or anti-social media. I'm Khurram Sadiq, I'm a consultant psychiatrist, and social media and mental health is my niche area. So I want you to do an experiment, a kind of a test during this session. Can you please just put your phones away, laptops away, and devices away? And before doing that, put the timer on. And the next time when you pick up the phone, check the timer. And it will give you as to how much you can actually resist the temptation of looking at your phone. And I will tell you why later on during this presentation. Why am I saying that? Unfortunately, there's no prize for it, but at least you will know how resilient you are in actually resisting that temptation.